The movement has started and everyone is jumping on board. Fear-free. If you haven't already heard this phrase, you're hearing it now, as veterinarians are working really hard to create the best atmosphere possible for pets and their owners, both, according to veterinary behaviorist Dr. Debra Horwitz.
When you go to veterinary school, your focus of what you're taught is health. How to diagnose and treat disease, how to keep pets healthy, and you do that within the setting of your veterinary clinic. And we're trying to raise the awareness because veterinarians do not want it to be problematic for the pets, and we're trying to help them give tools to their owners to say, we'll all do better if we start at home. And so when your cat comes in less stressed, we're going to be able to do better, and we're going to have new tools to relax you. Food treats, coverings on the table, separate rooms, all sorts of things that veterinarians would love to do if given a protocol to do that, and Fear-Free is going to really help them do that, from leaving the house to putting them in a cage, to treating their disease and sending them back home and having them live a long life in their forever home.
So Dr. Marty Becker, along with a whole group of others, including yours truly, is leading the charge to give veterinary professionals the tools they need, because the fear some of these pets have is truly debilitating.
What happens with these pets increasingly is they have maladaptive fear. Just the thought. They don't have to be put up on the table. They don't have to be their tail lifted up and something put in the wrong way. They don't have to be vaccinated. Just the thought, or just driving up to the hospital, causes maladaptive fear. So you start seeing them panting. They start seeing you can see the heart beating through their chest. They're salivating. They're licking their lips. They're yawning, doing all these overt signs of stress.
And all that stress leads to frustration for the pet owner and veterinary professionals, ultimately leading to avoidance of veterinary visits, and that is not good for our pets.
So what a vicious cycle. So what most of them do, it's not worth the hurt to my pet, because I know it hurts it to go. It's not worth the hassle, so I just won't go. You know what? I'll go on the internet. I'll find what I think is wrong with it, come up with a treatment plan. Those are all fine, except I can tell you 5 cases in the last 2 or 3 years where somebody went on the internet looking for vomiting and diarrhea and thought it was digestive upset, dietary indiscretion. Take them off food, boil hamburger, a little bit of water, Pepto-Bismol, kaopectate. One had swallowed carpeting, had a perforated, so had a blocked intestine that had ruptured. By the time it came in, a septic abdomen full of pus. It didn't make it. Another one got into rodenticide, a large amount of a rodenticide, decon to be specific. By the time they come in, too late. Another one got into ethylene glycol, come in too late. Another one had bloat, come in too late. So we got to get ways to want them to want to be able to bring their pet to the veterinarian. So that's what creating fear-free visits is it's what happened in pediatric dentistry years ago. It's why I, as a child, hated to go to the dentist, because there was no concern for my comfort, my well-being, my emotional state.
So your veterinary team is working hard to make sure these visits get better, and they can. And we'll give you tips to help you make that happen over time. I'm Steve Dale.